Hi, my name is Megan Renard. I'm doing the presentation video. A little about myself. I'm 34 years old. I was born in Adrian, Michigan. We moved out to Trenton when I was about a year old, and from there we moved to Romulus, where I lived until I was around 21. Moved out to Carlton from there, and I've pretty much lived in the Monroe County area ever since. Have a older sister and a younger brother, suffer from the middle child syndrome, but now that I'm a little older, I'm actually the caregiver. My parents are both healthy and alive. I do take care of them when they need it. I live 10 minutes away from them. I do whatever I can. I'm supportive of them. My brother lives out in Chicago. My sister lives an hour away, so I'm the closest family member to them. I also have a 10-year-old daughter. She's in soccer. We do karate. She's just started band, things like that. So pretty active with her and stuff with sports. Jobs, so I started off as a CNA in 98, which got me into my medical field. I was originally looking more into paramedic. I started off as the basic EMT, moved up. I went to school for my paramedic license. While in school, I became pregnant, learned I have motion sickness. I continued to have that motion sickness, and I also learned that um, wanting to do fire medic, I'd rather run out of fires instead of into fires. So I learned that that really wasn't going to be a career goal for me. My instructor was a huge help for me though, and got me into nursing school, gave me information, and really convinced me into joining for nursing school. And I have been a nurse since 2005. I started off with nursing as a cardiac telemetry step-down nurse. Worked that for about 2 years between the two different hospitals that I worked at. I went into hospice from there, loved hospice, have some really great emotional, touching stories from there. And the only reason why I did stop is I really hate driving. Um, I had slid out on ice, just trying to think of if I crash the car, that pretty much stops me from being able to get back and forth to work because I really can't have somebody drive me around even if I borrow a car to get to work or ask somebody to drive me into work. So I started looking more into a stable in a hospital setting type of job, which led me into rehab, and I have been there for 4 years now. I just started my position as a case manager. I do love that job as well. I work with patients on discharge. I look into them while they're there. I manage the caseload depending on however many patients are there on the unit. We are a 38-bed unit right now. So just depending on whatever the caseload is, I look into them, look into their labs, make sure everything is looking good because the nurses aren't always consistently the same. So I try to assist them so that nothing gets overlooked. I also manage, if they have appointments scheduled, I look into which ones need to be kept, which ones can be wait, until discharge or whenever. I look into at discharge if they're needing oxygen, IVs, tube feedings, things like that. What may help them when they get home. Try to make that transition back to home a little bit smoother. The times when you can make something go really smooth, it helps me know that making that transition smoothly for them, it makes my day, basically. That is the most rewarding. Those are the kind of things I like in nursing. And there's one time I helped a patient who couldn't afford medication that an insurance wouldn't cover. It was a $1,500 fee for an antibiotic that he had to take, and he couldn't afford that, and I was able to get that medication for free for him. And those are the touching experiences that you have in nursing when you can do that and know that you really help somebody out. Some hobbies of mine, I like reading Doing a lot of activities with my daughter. Kind of a big nerd. I'm learning how to quilt. I do cross stitching, little arts and craft type of things. My daughter makes necklaces, and I help her out with those. I do kind of, I guess, a unique little thing about myself is I do nails. Anything to really help me calm down on a bad day. I put nail designs on my nails. I polish them. So right now I do like skeletons and pumpkins and things like that for the season for Halloween. Otherwise, that's pretty much all. Career goals for me would just maybe possibly getting into my nurse practitioner, but I haven't quite decided with that because I really am not wanting to finish off with school, but probably will because it's only another 2.5 years, so don't got much else to lose. So that's pretty much me in a nutshell.